HIV. These three letters stand for Human Immunodeficiency Virus, a term that carries significant weight and importance in the medical world. Just three letters, but they carry a lot of weight. HIV is a virus that has had a profound impact on millions of lives around the globe. HIV stands for Human Immunodeficiency Virus. It's a virus that specifically targets the immune system, which is our body's natural defense mechanism against infections and diseases. It's a virus like the ones that cause colds or the flu, but HIV is different. Unlike the common cold or flu, HIV doesn't just make you feel sick for a few days and then go away. HIV attacks the immune system, our body's defense force. It specifically targets and destroys a type of white blood cell called CD4 cells, which are crucial for fighting off infections. Think of your immune system as an army. This army is always on guard, ready to defend your body against harmful invaders like bacteria, viruses, and other germs. This army protects you from invaders like bacteria, viruses, and other germs. But when HIV enters the body, it acts like a sneaky spy. HIV is like a sneaky spy that infiltrates this army. It hides within the very cells that are supposed to protect you, gradually weakening your immune system from the inside. It weakens the army from the inside, making it harder for your body to fight off infections. Over time, as more CD4 cells are destroyed, your immune system becomes less effective. Over time, HIV can weaken the immune system so much that it can't fight off even minor illnesses. This is why people with untreated HIV are more susceptible to infections and diseases that a healthy immune system would normally be able to fend off. This is when HIV progresses to AIDS, or acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection, where the immune system is severely damaged. AIDS is the most advanced stage of HIV infection, but there's good news. With modern medical advancements, HIV is no longer a death sentence. HIV is preventable and treatable. There are effective ways to prevent HIV transmission, such as using condoms and taking pre-exposure prophylaxis, PrEP medication. With proper medical care, people with HIV can live long and healthy lives. Antiretroviral therapy, RT, can control the virus, allowing individuals to lead fulfilling lives and reducing the risk of transmitting the virus to others. Let's talk about how HIV enters the body. HIV is spread through certain body fluids, like blood, semen, vaginal fluids, and breast milk. It can enter the body through cuts or sores in the skin, or through the lining of the mouth, vagina, or rectum. Once inside, HIV targets a special type of cell called a CD4 cell. Think of CD4 cells as the generals of your immune army. They lead the fight against infections. HIV enters these CD4 cells and integrates its genetic material into the host cell's DNA. Imagine a thief breaking into a factory and taking over the machinery to produce more thieves. That's what HIV does inside CD4 cells. It hijacks the cell's machinery to multiply and spread, gradually weakening the immune system over time. The journey from HIV infection to AIDS is a gradual one, often taking years. Understanding this progression is crucial for managing the disease and improving the quality of life for those affected. Let's break it down into stages to better understand how the virus affects the body over time. Stage 1, acute HIV infection. This is like the initial flu phase. Some people experience flu-like symptoms, such as fever, headache, and rash, while others don't notice any symptoms at all. During this stage, the virus is multiplying rapidly and spreading throughout the body. The immune system responds by producing antibodies, but it can't eliminate the virus completely. Stage 2, clinical latency. This is the quiet phase. HIV is still active but replicates at very low levels. People in this stage may not have any symptoms, but they can still transmit the virus to others. This stage can last for many years, sometimes even decades, especially with proper medical treatment. Regular monitoring and antiretroviral therapy are essential during this period to keep the virus under control. Stage 3, AIDS. This is the most advanced stage of HIV infection. The immune system is severely damaged, making the body vulnerable to opportunistic infections and certain cancers. These are infections that wouldn't normally make a healthy person sick, but can be life-threatening for someone with AIDS. Symptoms can include rapid weight loss, recurring fever, and extreme fatigue. Early detection and treatment are key to managing HIV and preventing the progression to AIDS. Section 4, HIV versus immunity, a battle for your health. HIV is a master of disguise. It primarily targets the CD4 cells, which are crucial for our immune defense. As HIV replicates, it depletes these essential cells, compromising the immune system's ability to combat infections. Picture a castle under siege. The castle walls symbolize our immune system. HIV acts like a battering ram, persistently assaulting the walls and weakening them over time. Eventually, the walls deteriorate, leaving the castle exposed. This is analogous to the body when the immune system is critically impaired. The body becomes vulnerable to infections that it would typically be able to fend off. Section 5. Fighting back treatments and prevention methods. The good news is that we have powerful tools to fight HIV. Over the years, medical advancements have provided us with effective treatments that can manage the virus and improve the quality of life for those living with HIV. Antiretroviral therapy, or ART, is a type of treatment that stops HIV from replicating in the body. This therapy involves taking a combination of HIV medicines every day. Think of ART as a set of brakes on a speeding car. Just as brakes slow down a car, ART slows down the virus, keeping it under control. These brakes slow down the virus's replication, preventing further damage to the immune system. By doing so, ART helps maintain the health of the person taking it. People on ART can live long, healthy lives and have significantly reduced chances of transmitting the virus to others. This means that with proper treatment, HIV-positive individuals can lead fulfilling lives. Prevention is just as important as treatment. By preventing new infections, we can work towards ending the HIV epidemic. We can prevent HIV transmission through various methods, including the use of condoms, regular testing, and taking preventive medications. Using condoms correctly every time you have sex is one of the most effective ways to prevent HIV. Condoms act as a barrier, stopping the virus from passing between partners. Pre-exposure prophylaxis, or PrEP, is a daily pill that can prevent HIV infection in people who are at high risk. When taken consistently, PrEP is highly effective at reducing the risk of contracting HIV. Post-exposure prophylaxis, or PEP, is a course of medication that can prevent HIV infection after a possible exposure. PEP must be started within 72 hours after a potential exposure to be effective. Education and awareness are also crucial in the fight against HIV. By spreading knowledge about prevention and treatment, we can empower communities to protect themselves and support those living with HIV. Section 6. The future of HIV, hope on the horizon. The fight against HIV is far from over, but there's a lot to be hopeful about. Scientists are working tirelessly to develop new treatments and prevention methods. One promising area of research is a vaccine for HIV. A vaccine would teach the body to recognize and fight off the virus before it can cause infection. While a vaccine is still not available, researchers are making significant progress. Another exciting development is the potential for long-acting injectable treatments. These treatments could provide sustained viral suppression with fewer doses, improving the quality of life for those living with HIV. Section 7. Living with HIV, you are not alone. Living with HIV is not a death sentence anymore. With proper medical care, support, and a positive outlook, people with HIV can live long and fulfilling lives. Remember, HIV does not define who you are. It's important to seek support from healthcare providers, family, friends, and support groups. Connecting with others and sharing your experiences can make a world of difference. The fight against HIV is a collective one. By understanding HIV, supporting those living with the virus, and embracing prevention methods, we can create a future free from HIV. Today, there are numerous online resources and mobile apps that provide support and information for people living with HIV. Telehealth services and virtual support groups have made it easier than ever to access care and connect with others, no matter where you are.